Generally speaking, as the Infectious Diseases Institute, we are very cognizant in regard to safety because we deal with infectious diseases. At a personal level, I'm required to observe personal safety through knowledge of training, but also we have what we call the Infection Prevention and Control Committee, and this IPC committee is the one mandated with ensuring that we have up-to-date training. So this IPT committee over the years has been largely inculcated into routine care at IDI, and this primarily rotates around hand hygiene and all the aspects of hand hygiene before patient contact, after patient contact. We actively practice hand washing techniques. As you see, I'm working with my alcohol hand rub, and this is to ensure, this was given to us by the IDI, and everyone has an alcohol rub, but also within the environment that we work in, we have alcohol dispensers and taps within almost all the rooms. So in terms of infection prevention control, we are working in a very safe environment, I should mention, and that is provided for by the IDI. Other aspects of infection control really come in with respect to the particular care that you're giving. If you're doing like a procedure, then we have the required things to support us during our work. For instance, our cleaners here at the IDI, they're very knowledgeable about the various waste segregation techniques, and they are readily available. I should say that if a patient spilled something, vomited, or did what, we don't feel threatened at all. And we've also been able to respond. As you can see, we are doing a lot of work outdoor because we want to maintain the safe distance that is the requirement of the COVID-19 pandemic. And for us, that's a very robust response, that we are not mandated to give care now within the building, but rather from outside, which ensures that we are safe as well as the patients are safe. Facilities out there and managers or doctors out there should ensure that, as we always say, safety first. And if you're going to weigh between the cost of a glove and someone's life, I would say you lose the cost of the glove. So first and foremost, I would encourage that people use personal protective equipment, right from gloves, masks, hand washing. So facilities should avail these things readily available to their doctors or health workers, and this should be in keeping with the amount of risk. No one should be coerced into doing a ward round without personal protective wear. The other thing is ensure personal safety. Things like waste management techniques in facilities, cleaning departments, ensuring that they have supplies like soap and water, Jik at the right concentrations, and ensuring that you educate people to handle waste in line with the amount of risk that is inherent in that waste. Sometimes people may lower their personal guard because they think they're used to certain conditions. I think that's not very right. The risk is true for a patient as it's true for a health worker.